Zhang joins us now from Shanghai. He's the chairman of the Shanghai Xiangyang Foundation, which is active in public health. We just heard from Francis there in that story. It's my understanding that China also has a shortage of cadavers. Why is that, and do you think this technology can help?
Well, I think that this kind of technology will be very beneficial to all of the China because this is a big country, and they need the medical service improvements.
So give me your sense of how the VR could change.
Earlier this year,
go ahead, I'm sorry.
Yes, see, earlier this year, Cleveland Clinic visited the Shanghai Regional Hospital, and then also the Chinese traditional medical universities. We discussed the two topics. One is the cadaverless medical education, and then another one is how we can make a combining the Chinese traditional medical education with the system. Well, I think firstly, to China, we have 1.4 billion people. Everybody know that. But you can really hardly imagine how many doctors and nurses we really need. And in the recent years, our governments strongly promote the hierarchical diagnosis and treatment. They also clearly state the healthy China is so important to the China future. So in that case, how we can deliver so many doctors and nurses to the countryside, to the small town and the village. And we do need a new education system and a new technology like VR to show the people and to make all of the people have the better education and the knowledge and the skills. So where they can get this, they come through the new system. So that's why I feel this is very beneficial to China.
And when you look at VR and you think about the young people coming up nowadays, this really connects with them in a sense. So how do you see this changing the general landscape of medical care in China moving forward?
I just mentioned the Chinese government need all the the country with the larger population and a vast territory. So a lot of people and especially all the doctors and the nurses are in remote. How we can deliver the knowledge to them, and they are now currently working in a small town and the village. How we can do this? And they also need to improve their ability to get the more education. So that's why I feel right now the education only concentrated in the big cities and in the campus education, but that's only for the small number of the students. And they're lucky to go to school. But how about the other doctors and the nurses?
And this undoubtedly will.
So I feel that's the. Yes.
No, go ahead. I'm sorry to interrupt.
Yes.
So you were going to say.
Well, so that's why I. So that's why I say, because we just visit all the different parts of the China, and we visited all of the villages and the small towns. And I feel the way to have those doctors and the nurses get much better education and a modern technology, and then they will know how to treat people, how to make a good medical service. And our government also promote the sound medical service we should deliver to every family and every individual in the whole country. How can we do this? We have to go through the technology and the VR system and to make the people get better skill education.
Wang Zhang joining us from Shanghai. Thanks so much for your insights.